My name is Gianna Tortolani. The date is October 30th, 2018. I'm going to be doing a video on hand washing, putting my PPE on, the glucometer, injections, and sterile gloves. First, I'm going to wash my hands. I'm going to turn the water on. I'm going to wash for 15 seconds. Down. I'm going to pat and not rub. I'm going to turn the water off. I'm going to dispose of that. Now I'm going to apply my PPE. I'm going to put my gown on first. Put my mask on. Now I'm going to put my gloves on. Alright, and now I'm going to do my injections. Alright, first I'm going to identify my patient with his birthday and name. I'm going to verify the doctor's order. I'm going to do a subcutaneous injection first. It's going to be a 25 to 27 gauge, 5/8 inches, up to 2 milliliters that you can do in the abdomen, 2 inches away from the navel, in the upper arm, or in the front of the thigh, at a 45-degree angle or 90 degrees if they're obese. I am going to clean the skin with alcohol, and then I'm going to clean the vial with another alcohol swab. I'm going to get rid of those. I am going to take the cap off the needle. I am going to pull back as much air as I'm going to inject. I'm going to put it in and push the air back in, and then I am going to withdraw as much as I'm going to inject. I'm going to do it at a 45-degree angle. I'm going to bunch the skin. I'm going to inject it, and then I'm going to inject it. I'm going to hold it there for 10 seconds, and then I'm going to remove it at the same angle that I put it in. I'm going to put that in the sharps container, and then I'm going to put that there, and then I am going to throw it away, and then I'm going to document, and then that's going to be it for the subcutaneous, and then I'm going to do my IM injection. It's going to be a 20 to a 25 gauge. I'm going to do, it's 1 to 1.5 inches. You can do up to 3 milliliters in the deltoid, the vagus lataris, the ventral gluteal of the hip, and or the dorsal gluteal of the buttocks. It's going to be at a 90-degree angle, and you have to aspirate unless it's a vaccination. And I'm going to get my needle for that. So I'm going to first clean with an alcohol swab, throw that away. Clean with a different alcohol swab, throw that away. Uncap my needle, and then I'm going to pull back as much air as I'm going to inject, put it into the vial, put the air in, pull back as much as I'm going to inject, and then I am going to tighten the skin. That's going to go in at a 90-degree angle. I'm going to inject it. I'm going to aspirate first, and then I'm going to inject it, and then I'm going to remove it at the same degree that I put it in, put that in the sharps container, and then hold it down. And then that's going to be it for that. And now I'm going to document that. And then I'm going to remove my PPE. So I'm going to take my gloves off first. I'm going to throw them away. I'm going to take my mask off. I'm going to throw that away. And I'm going to take my gown off. I'm going to untie the back. I'm going to untie the top without touching the front at all. And I'm going to go under. Bunch it up without touching the front, and I'm going to throw it away. then I'm gonna wash my hands again. And then I'm gonna put my sterile gloves on. So I'm going to take it out of the package. I'm gonna open the package. And I'm gonna be sure to only touch the outside. Breaking sterile technique. All right, and I'm gonna throw, oh, I wanna touch that. I'm gonna come over here and do my glucometer. I am going to ID the patient, his name and his birth date. I am going to alcohol swab the finger. I'm gonna get all my supplies ready. I'm gonna have my lancet, I'm gonna have my strip, and then I am going to explain the procedure to the patient, and then I am going to use the side of his finger. I'm going to inject the lancet. I'm gonna put the lancet down, and then I'm gonna wipe away the first drop of blood, and then I'm going to get the strip, and I'm going to get the second drop of blood, put that down, and then I am going to wipe, I'm going to give him a paper to apply pressure to his finger, and then I am going to take my gloves off, and then I am going to document, and I'm going to throw the lancet in the sharps container, and then I am going to wash my hands again, and then I am going to put clean gloves on again, and I am going to alcohol the glucometer, and then I am going to take my gloves off, and then I would be done. Thank you.